I am Dr. Upendra, Senior Consultant Urologist, KIMS Hospital. Today we will learn about lot of people complain of pain in the both testes for longer periods. So sometimes they can have swelling also of the testes, bilateral testes. So what is the reason for this? Many of the patients usually they have associated symptoms like frequent urination, difficulty in passing urine, or urinary burning, pain, etc. So some of them can have history of smoking, because smoking can lead to tuberculosis. They can have genital tuberculosis. So very common in India. So we need to be very cautious. Somebody having smoking history has to be seriously taken for that. It could be a COX related condition. So apart from this, patients having diabetes mellitus, who are having diabetes, also are prone to get this testicular swelling. This is called orchitis or epididymoarchitis. So we need to be very cautious. And second thing, patients above age of 50 can develop symptoms of prostate enlargement. They also can develop testicular swelling, pain, frequent infections of the testes or urine. So we need to be very cautious. Any patients having genital swelling, like having swelling in both testes or one side testes, having urinary symptoms like burning, pain, frequent urination, urgency. So all these needs to be screened for one, diabetes, for which you should do blood sugar. Number two, as I said, if he is a smoker, he has to undergo MAN2 test and one chest x-ray to rule out any tuberculosis. And then patients having prostate enlargement, they need to undergo ultrasound scan, uroflowmetry and serum PSA. All this will give an idea that is there any source which is causing problem in the testis, or it is direct source. Directly the testis gets infected only in tuberculosis. No other conditions, generally it causes direct testicular infection. So we need to be very cautious, and these infections have to be controlled immediately. And for confirming the diagnosis, we need to do a scrotal Doppler, which will tell us which testis is involved and how severe is the infection. And in children particularly, if there is a testicular swelling, the first diagnosis should be torsion testis. Torsion testis means the testis rotates on itself. That leads to torsion testis, and within 4 hours, if we don't detorse it or do a surgery, automatically the testis dies off. So lot of children, we have to remove the testis, and that in future they can have problem with children, fertility problems, potency problems, all this can occur. So torsion testis in children, any children having pain and swelling of the testis needs to immediately approach the urologist, and mostly it is a torsion which needs immediate surgery within 4 hours. So that needs to be taken care in all testicular swellings. And some people can have penile swelling, that is because of penile fracture, very rare incidents, that is called penile fracture. Second thing, some people can have infection of the skin part, that is called BXO. There is one condition where a patient can have infection of the penile skin, that can also lead to swelling. And sometimes due to other conditions like liver failure, kidney failure, patient can have swelling in the genitalia. That is only dependent edema. We call water gets collected whole body, so it also collects in the genital area. So that is called dependent edema. So that doesn't require any major surgery. But if patient having infections with hydrocele, that means water collection in the testis, that needs sometimes surgery also, called hydrocelectomy. So these are the common causes which you see, either infection, rarely sometimes tumor can also occur, particularly normally all cancers occur in the elderly people, but cancers in the genital area, particularly the testis, they occur in children. So we need to be very cautious. That is called testicular carcinoma. It needs to immediately get diagnosed, and immediately surgery has to be done. Otherwise, the stage 1 will progress to stage 4 within 1 month. So these are all the various conditions which can lead to genital swelling.